You're evaluating a 7-year-old Doberman presenting with weakness, exercise intolerance, and increased respiratory effort. Even before you see any imaging, two things stand out. One, this breed is predisposed to dilated cardiomyopathy. And two, the heart rhythm is irregular. That rhythm alone may be contributing significantly to how unstable this dog feels. You take a look at the ECG. The rhythm is completely irregular. There are no discernible P waves. And now the question becomes, what's happening electrically? And why does this rhythm matter in dogs like this? Hi, I'm Dr. Haley, board certified veterinary cardiologist. I teach ECG interpretation through physiology and electrical mechanisms rather than pattern recognition. By the end of this video, you'll be able to take an ECG like this and explain what's happening electrically and understand why atrial fibrillation can be destabilizing, particularly in dogs with underlying myocardial disease. But before we dive into atrial fibrillation, let's recap what normal atrial activation looks like. In normal sinus rhythm, electrical activation begins in the sinus node. The wave of depolarization spreads across both atria, and that organized atrial depolarization produces a single P wave. That impulse then enters the AV node and slows down briefly. Then the impulse spreads through the His-Purkinje system, activating the ventricles regularly and predictably. But atrial activation is not just an electrical event. The organized depolarization is followed by a coordinated atrial contraction just before ventricular systole. The atrial contraction contributes to ventricular filling. In healthy hearts, loss of that contribution may be tolerated, but in dogs with systolic dysfunction and ventricular dilation, that contribution becomes much more important. This entire system is what breaks down in atrial fibrillation. Now let's transition from organized atrial activation to what happens in atrial fibrillation. In atrial fibrillation, there is no single dominant pacemaker. The atria are not being driven by the sinus node. Instead, multiple wavelets of electrical activity circulate simultaneously through the atrial myocardium, causing haphazard activation of the atria where there is no coordinated atrial depolarization. And because there is no coordinated depolarization, there is no coordinated atrial contraction, and the atria just quiver rapidly. Atrial fibrillation requires a substrate. For example, in large breed dogs with dilated cardiomyopathy, that substrate develops over time. Chronic elevation of filling pressures leads to atrial dilation and stretch. That stretch produces structural remodeling, fibrous and discontinuous conduction pathways. At the same time, electrical remodeling alters refractoriness and conduction velocity. The result is an atrial myocardium capable of sustaining multiple continuously circulating wavelets. No single impulse dominates, and because these impulses occur at extremely high rates, they continue to bombard the AV node. The AV node now becomes the gatekeeper. Whether any individual impulse conducts depends entirely on the refractory state of the AV node at that moment. Some impulses conduct, many do not, and the timing is unpredictable. This is why the ventricular rhythm is irregular. There is no repeating pattern to the R-to-R intervals. And because atrial impulses never organize into a true P wave, there are no discernible P waves on ECG. Instead, we see this fibrillatory baseline with no organized oscillations. So let's take a look at this ECG. We can see that the baseline is not isoelectric. It contains subtle, fine, regular oscillations. These reflect ongoing atrial electrical activity, not organized depolarization. The QRS is narrow in most dogs. That tells us that ventricular activation is still occurring through the normal His-Purkinje system. In this dog, the QRS complexes are a little wide, and that reflects a marked remodeling of the heart in this patient with DCM. But the defining feature remains the irregular ventricular response. In dogs, atrial fibrillation almost never occurs in isolation, most commonly reflects advanced structural heart disease, and the rhythm itself worsens hemodynamics in two key ways. First, loss of the atrial kick or in other words, loss of coordinated atrial contraction, which reduces ventricular filling. Secondly, usually we see a rapid ventricular response rate. The rapid and irregular ventricular rates shorten diastolic filling time. So, in dogs with already compromised myocardial function, these effects can significantly reduce cardiac output. And this is why the rhythm itself can contribute strongly to clinical instability. So, key takeaways. Atrial fibrillation is defined by chaotic atrial electrical activity with no organized P waves. It produces an irregular ventricular rhythm due to unpredictable AV nodal conduction, and it typically reflects significant atrial remodeling and structural heart disease in dogs. Its clinical impact comes from loss of coordinated atrial contraction and impaired ventricular filling. That concludes our case study on atrial fibrillation. If you want to go deeper in rhythm recognition and actually understand why ECG patterns behave the way they do, that's exactly what we teach inside Opti ECG. Opti is an ECG teaching tool and clinical ECG case library where the rhythms are expanded into full patient cases with mechanism-based ECG interpretation, clinical context, and step-by-step reasoning. If you want access to the complete Opti ECG case vault, you'll find the link in the description. Feel free to comment below which ECG rhythm you'd like me to break down next. I hope this helped with your understanding of atrial fibrillation in dogs. I look forward to seeing you in the next case study. Bye for now.